Welcome back to Let's Talk Title IV, a podcast brought to you by the Title IV Part A Capacity Building Initiative. I'm Tiffany Lofton, and in this episode, we're bringing you a conversation with Dr. Ninfa Peña-Purcell. Dr. Purcell is a research scientist at the Center for Community Health and Aging at Texas A&M University. In the conversation, she shares an overview of the university's Texas Opioid Prevention for Students, or TOPS project, with the ESC Title IV specialists at our monthly meeting. Let's hear what Dr. Purcell has to say.
Thank you so much. And I'm excited to be here because we were funded January the 8th by the Opioid Abatement Fund Council, who received opioid settlement money 2 years ago. And now this year, they're ready to utilize those funds to address the opioid crisis. And one area of and I'll just call it OAFC, the Opioid Abatement Fund Council, is in prevention for K through 12th. And this past fall, we submitted a $25 million grant to be the provider to support schools across the state of Texas in their opioid prevention efforts. And I'll describe that in just a little bit. But before I get started, I will introduce our team of investigators in this project. But I really wanted to communicate our theme and our message of the work that we're doing, and that this is settlement money that is really that our state has received, that has come from thousands of lives lost due to the opioid epidemic that we have been seeing since the 1990s, when there was an overprescription of opioids for pain meds. And then now we're seeing the fentanyl crisis that we're hearing happening and impacting our Texas youth. And with those deaths, I just thought that really that our message is that we want to honor lives lost to opioids and to empower youth in prevention. And to that end, we are charged with supporting schools across the state of Texas. We're new because our contract was just executed yesterday, and we're dancing happy feet for the fact that it takes a while to get the grant and the money up and going, but we're ready to mobilize all of our assets across the state of Texas. And we have been in conversation with several ESCs just through us reaching out to ESC directors and letting them know that we're funded and that we will be rolling out this initiative. So getting back to our leadership team, it's myself. I am research scientist, but I wear many hats there. And I'm more of what I call a community health practitioner. I really work very strongly with communities and schools to identify their needs and build capacity to help them with addressing health needs. But one area that I have been focusing on in the last few years has been with opioid prevention for youth in a curricula that I am lead author called Think Smart. And there are two pieces of resources that I sent out to Tiffany that she can share with you, and that file will be available for you. And so that's my role there. Dr. Marcia Ori is a Regents Fellow, and she is also not very involved in evaluation research. She's also involved in community-based health programming. And then Dr. Joy Alonzo, she is a PharmD. She's got a master's in engineering, and she's a faculty pharmacist in the College of Pharmacy. And so she has done a lot of work in naloxone training, both in schools and for professionals like EMT, first responders, and she's been doing that work. As a team, we have the opioid task force, the Texas A&M opioid task force, and we have been doing this work since 2018. And it's interesting that we have been poised for this grant because we've been supporting schools with naloxone training. I've been doing the work with opioid prevention with the Think Smart. So all of these assets have really helped us pull together a very strong proposal that the OFC saw was what they needed with that infrastructure to do this work across Texas. So the purpose is a multi-component initiative to provide K through 12th grade students with opioid prevention in response to the urgent opioid crisis. Now, I can say that it's multi-component, focused on prevention with students, but we are more than that. We have a community engagement piece. So we're going to be rolling out a needs assessment to principals to find out what work they're currently doing in opioid prevention, and also if they're meeting the Tucker's Law and what that looks like and what kind of resources they need. So we can kind of assess the landscape of Texas and what's currently happening in schools. While we get that needs assessment, we're not going to be staying idle for us to get the information back. We're going to already start rolling out resources this year. It's a 3-year project, and we have to hit the ground running. But we also have community engagement. So I know that there is funding to ESCs to provide parent and community engagement, and we also have resources for that. We're going to be conducting community conversations to hear back from communities and schools, parents, what are their needs around opioid prevention, especially focusing on the fentanyl crisis that we've been hearing. And I could talk a lot about that because we have seen clusters of fentanyl overdose, like one school in Cleveland, Texas, where they had, I can't remember how many students, it escapes me, but a number of students had an overdose in the school bathroom. And so we're responding to that. We had a community meetings at a school there to see how we can address that there in Cleveland, Texas. So it's all over the state, and we know that, and this is the support that we bring to the schools. So I just wanted just to kind of let you know how we're going to do our work. And I'm not going to park it too long because I have so much more to tell you, but we are the hub, but we are going to reach out to every single area in the state. So every area is represented in this spokes. So for example, Region 8 is far west Texas and all that area. If we go to, say, Region 4, it could be the coastal Bend area. And in each of these areas, we will have boots on the ground, 2 people that will help us liaise with the community that's already embedded there, but we're supporting with resources. We're the intellectual hub, but we're deploying everything and having people boots on the ground working with us. But a lot of this work is collaboration, building partners with key decision makers, with schools, with ESCs, and having conversations with what they're doing, what support they need, and how we can join forces with them in a collaborative way to support their needs. So we're across Texas. And so we have, like I said, what we call a community health organizer. We'll have a community health worker who's deployed to those areas. They're going to support us in helping us, start working in those communities, doing technical support that schools might need if they're implementing Think Smart, which I'll talk about in a little bit, and community outreach. So even though you're an ESC, you fall under one of these 8 areas, and there could be multiple ESCs under one of these areas. And for all the ESCs, we can support them with several of these events. And what is so exciting is that when I saw the Title IV and I saw the website and I saw that they were doing parent engagement, they have to do needs assessments, all of that is what we're going to support them because we're accountable to do the same type of work. Outreach events. A lot of times in the fall, there's Drug Awareness Week. We can support them for a big, multiply their work with a bigger campaign in their community and their schools around drug awareness. So we have the resources to support the ESCs, and it goes down to the school districts as well as the schools. So just to show you and give you a picture, it really takes my breath away when I think about the magnitude of this project, just because Texas is so big and we've kind of put them into those 8 areas. And so if you see there, you're going to see an area that you fall in, and we're going to have assets there, individuals hired there that are a point of contact, but we're also supporting them with the resources that were developed at Texas A&M, because we have a clinical staff, we have experts in evaluation. If you think about all the work that you have to do to support your grant, all the technical expertise we can provide and support in the work we do, so that just like you have to measure your successes, we have a strong evaluation team. And I'll talk a little bit about our evaluation. It's only going to be very high level, but we are going to be capturing data across the state. That the data that we capture probably is data that you need, that we can support you with that as well. So if I would kind of bring it into focus, the main things that we're doing, we're going to do needs assessment with schools with a survey. Right now we're focused on the survey, focused on principals because they know what's happening in their schools. And we're also going to be doing an assessment with SHACs, because SHACs are what we call our gatekeeper. They're the ones that approve the curricula. We know we need to work with them, and we will. Key informant interviews, and we're also going to look at data, just because there's data collected across the state, but it's disparate. It's like some people capture needs here, some people capture other information. And what we're trying to do is pull all this data sources to paint a picture of what's happening with the opioid prevention, the opioid crisis, and Texas youth across Texas. And if there's data that we can pull and really tell the story, that will be critical, because it can drive policy to help schools figure out what are the best strategies to address this opioid epidemic. We will do prevention education, K-12. Think Smart focuses more to 4th through 12th grade, but we will have a resource, a curriculum for kindergarten to 3rd grade as well. And what I'm really especially excited about is that we will also be providing a mental health screening for at-risk vulnerable populations, and that will include screening and referral to free counseling services to at-risk students. And then, of course, like I said, we have the community engagement piece that will include town hall meetings or community conversations. Social media, we hired a marketing person who's going to help us drive a marketing campaign, social media, however it's going to look like, to raise awareness across the state of Texas, targeting families and youth, but of course, reaching across the state and all of our statewide constituents. So our key partners, and we got a few letters of support in our proposal from a few ESCs, like ESC4, because we've worked with them. We've worked with some ESCs, but obviously not all. But we knew that the ESCs was going to be kind of like our centralized point. If I look at it as like our base camp, we're going to have 20 base camps, and from there we can reach the school districts and schools that they represent. We have a very close relationship with the high intensity drug traffic areas. HIDA is what they're called. They're a great resource from DEA, and they're in West Texas. They're in Houston. They're in Dallas, there's I can't remember how many HIDAs, but they are our collaborators and they have a lot of assets or resources that they also will support us in this work. We also will be partnering with the prevention resource centers. We don't want to duplicate our efforts. So what we're going to do is partner with PRCs, Outreach, Screening, Assessment, Referral, OSARs. Both of these are funded by DISHES. So we have partnerships with them. And so whatever resources they have, we can be a linkage, like to schools, if they want to say, well, PRC has X, Y, and Z. They may have community-based youth programming, or they may have some other mental health resources, and we can capitalize on that to help schools and build those bridges. So what we're doing is building bridges across all of these statewide resources so that we can work more collaboratively and in a unified way to really address the common problem that we have with youth in this opioid crisis. And then, of course, T-Chat. Some schools don't even know about T-Chat. We are a provider with T-Chat, and that's Texas Child Health Access through telemedicine. So that's gonna allow us to provide these clinical services that students who are at risk and identified that need services will be able to receive them. So what we're doing in schools, we're going to partner with schools to provide opioid prevention education, such as Think Smart and other resources. Because of the time limit, Think Smart, and I gave you a one-pager, is a 5-week hourly session of a life skills opioid prevention program. And I looked at your website and it says evidence-based. And I know that a critical piece is the Tucker's Law. And the Tucker's Law, it was finalized. It has to prove by SHAC. We can provide SHAC with a digital copy to approve it, and we can go and work with them. And we know that it's not a one size fits all, but we do have a manualized curriculum ready to roll. We can train school educators in it and get them resourced up to be able to implement it. If somebody says, well, I don't know, 5 weeks work with me, we can also work with DEAP for students that are in DEAP. And I'm using that acronym wrong. But anyway, the one that's in alternative school.
A discipline alternative education program,
Yeah,
DAEP.
DAEP, right.
Yes,
Yeah.
ma'am.
So we can also be able to adapt it in that environment as well. And so we want to roll training at schools this fall because we have to do that. I mean, we got to hit the ground running. And it may be the early adopters where we would love to have an ESC support us by hosting a training. It's a half-day training in the curriculum. And then when the schools get trained, we follow up with technical support to help them plan the program in their schools. We give all the student workbooks, we give them evaluation support, we give them everything they need to implement it. And then we engage with external collaborators to support the delivery. And we also use those external evaluators like PRCs and OSARs to help with mental health resources that schools may need. So evaluation, we have a pre-post test to look at behavioral and attitudinal metrics. Yes, knowledge is important. I do want to say that our curriculum aligns with TEKS and national standards. This is meeting TEKS, and it's going to get vetted by the SHACs so they can improve it. All the channels that need to be that we need to navigate for approval, we will navigate those and get through those different, I call them gates to get to the schools. And we reach parents and community with a 1-hour fentanyl training. Part of this is to pair this work with parent education. And we have a 1-hour fentanyl training that includes naloxone training so that parents can get a free naloxone kit, which is needed. Also, alongside the Tucker's Law, and I'll circle back to Tucker's Law, is House Bill 629, where staff have to be trained in naloxone. We can support them with the naloxone training for staff, developing policy. A lot of the schools have to get a physician to write off that they can have the naloxone in their school. We have Dr. Kowalczyk from Baylor University who will help sign off to schools that they can have the naloxone in the school. So we have all of that in place. We do qualitative data collection. But one thing, and I'll just very high level, is we are building a data management system called Insights. And Insights is awesome. It's a novel tool that's going to be a dashboard where we will track every single metric. So it's going to be real time, it's geospatial. So every time we get a school trained, we can map out and show where in Texas schools have opioid prevention education, the Think Smart program, and we can see where there's dark areas, if you will, and that they're not being reached. But we're going to have a strategy to touch every school in the 3 years. And we may go to 5 years, but suffice to say, this dashboard is going to be the way we can collect data, and it's accountability, transparency, and it's going to be able to track all this data real time. And we're building out that dashboard. And also part of our website is we're also building out, and we're going to stand up this mental health service that I talked about, and schools can go into that website and create a passport and be able to, in a protected site, be able to reach out and say, I have students who need counseling, screening. We can connect them to mental health screenings through our portal that we will have built out and standing up probably by the end of the year, the first of next year. So all of this is coming. You have to imagine that we're starting with just nothing and building out this huge multi-component, but we have all the assets and we're just pulling it all together and building some things, but they will be built out and stood up by the first of next year. And that's mostly the mental health piece for. So I know that there's some people that are not part of Title IV here, but I just wanted to just kind of pair what you're doing. And I looked at your website and I saw the things that I zeroed in was foster a safe and healthy drug-free environment. And so we have an evidence-based intervention. The Tucker's Law 3908 originally had 10 hours of education. And we were going off of 10 hours of education, which we can provide. Now the law has been finalized and there's no 10-hour requirements, but they also have suicide prevention. And I understand that. A lot of times suicide prevention comes from screening for mental health services and finding those children that are vulnerable. And so that's the piece that we can support, but it kind of falls under Tucker's Law. But I know that now that schools are like saying, great, I don't have to do 10 hours. I want to just say that a one-shot program, and there are programs where they come in and it's a shock and awe program and, and then they just give them the education. That will not move the needle in behavior change. Think Smart provides life skills that includes refusal skills, problem solving, harm reduction strategies that are age appropriate. And the funders clearly said that harm reduction strategy approach is needed in the programs that we offer. And Think Smart does that. So as you're thinking about what can I do to satisfy Tucker Law, while a 1-hour course may seem like it satisfied it and you check your boxes, it's not a behavior change program. And I'm not criticizing anybody who does these 1-hour kind of programs, But if you want to change behavior, you need an evidence-based program with evidence-based practice, and that's what we provide from K through 12th. But one size doesn't fit all, and we can adapt to meet your needs. We have the parent education. We can also build out we are also building out other educational awareness for the community, because at least we're raising awareness. But what you really need is an evidence-based behavior change program for students, screening, referral, and then technical support to customize. Now, I want to emphasize this: customize an opioid prevention program. We don't want to say, this is how you should do your prevention program. But what we are saying is, you need prevention education. What meets your needs? And we will have an array of services that we can help you figure out how to bring that together with what your needs are and what the resources that we can offer. And then support for under-resourced rural areas. We have received some funding, additional funding allocated for rural areas. Some of these areas don't even have a nurse in the schools, or counselors, or even a health clinic in their community. And so we're going to help them with that, if it means telehealth, which is a lot of times the way to go for mental health services. I do want to say that when we talk about customize, it's more understanding what your needs are. And so you may have already been doing a needs assessment and have funding for that. But one ESC that I'm working with, ESC 2, and I'll be glad to say that, just got their mental health funding. We had a long conversation and realized what they need to do to satisfy their grant, we're doing as well. So we're partnering to support each other and maximizing their efforts. So they may have a certain amount of money to do something, but then they could do that and additional, because we can resource them with whatever is needed. So it's a matter of just coming to us and saying, we have a grant, and some of these are just $30,000 grants. And while that's could be, sounds like a lot, there's such a great need that more money is needed. And this is where we can start having conversations. So in my vision is that every ESC comes to TOPS. We have a meeting, we work out with them what is the best approach to reach the school districts and schools, but the ESCs themselves, when they have the grants that they need to satisfy their metrics like parent education, we can say, this is how we can help you, and use our resources. Or even a lot of times you don't have these things built out, like you don't have the content for a presentation. We may have those resources. So I feel that what I'm seeing on the Title IV Part A, and maybe some of the other funding that other ESCs are receiving, it shouldn't be looked at as siloed, but that we're here to help you. And that's what TOPS is here to do. Change. So next steps is change. I don't want you to think that this is solidified, but we just got our contract executed yesterday, high five, and we're just kind of thinking optimistically, but we're thinking realistically that we want to start having conversations with ESCs and figuring out what are their needs, and then kind of coming up with a plan. And then ideally, one thing that I'm working toward is at least starting them out with maybe a training for Think Smart. Another thing is that I'm exploring another type of training. These are in-service trainings. But one thing that it came to me that I had an epiphany was possibly having an in-service, maybe schools come, and it's basically how do you comply with Tucker's Law, understanding the law, how do you put together a prevention program that meets your needs, and maybe just starting from that customized approach and looking at how to address their needs that meet their schools, and then they go back out. We provide the technical support. But initially, we really do want to try to get the Think Smart into schools, but that's not the only thing that is what we're offering, but at least to get them trained. And if somebody misses that opportunity, keep in mind that it's not a one and done. We're going to keep coming back throughout this 3-year cycle, possibly 5 years, and keep supporting ESCs. It's an evolving thing. There's a lot of unknowns for us. And so we will have, it will be constantly iterative and hearing back and getting feedback, and what school didn't come to a training, what school is, needing to be reached, where can we help them? So I spoke a lot, and I tried to just kind of zero in on what your initiative is about and showing what TOPS is. We're new, but we're really we're state funded, and we're here to support you. And the state wants us to do this, and we have the resources and the capacity to support this. But the learning is for us is to basically have that first conversation with an ESC, whoever the point of contact. And I'm finding that it's different. One ESC was nurse managers. Another one was family engagement. And so now it's like, I have no idea who's the point of contact. Yes. And so I'm going to stop there because I might be going over time. And I know that y'all have a lot of questions. I did provide a resource, a one-pager on Think Smart and a one-pager on our project, because I think it'll summarize what we're doing. And just envision our project with your name on it, that we're here to help you and meet your deliverables, because all of you are funded and within the scope of what you have to do. And I think there's a lot of things that you may not be able to do because of not having the resources. So I'll stop there.
Well, we really appreciate you reaching out. Folks, one of our main goals in today is, this is a state requirement and this is state funding. So when we talk about Title IV, you have to be very careful when it's state requirements and state funding. But so many of us don't wear just one hat at our ESC. And so my main reason for bringing Dr. Peña-Purcell here and to talk about the TOPS program is because you may have Title IV on one hat and you may have counselors on the other, or safety on the other, or nursing on the other, or whatever. And so we figured this would be a good way, one, to get her in front of the ESC so that you guys can then have internal conversations and go, who needs to reach out to this? Who needs to be a part of this initiative? And how can our ESCs partner effectively to help our students? And so, that's the main reason here, is not so much maybe it's blending with Title IV, but to, again, get her in front of everybody so we can figure out, here is a state resource to meet a state requirement. So then, how can maybe Title IV go above and beyond later? So that was probably our primary mission. But my question to you is, what questions might you have? I know we had one in chat, Tiffany. And then if you guys had questions, we want to have that opportunity.
Yes, so our one question that we did receive early was, could we get a copy of your presentation? Even a PDF version of it that we could have.
Yeah, I can do that as well.
Awesome. Thank you. If anybody else has a question, feel free to unmute your mic and ask your question, or you can drop it in the chat and we'll ask it for you either way.
You guys are going to be shy today.
Yeah. And it might be that they're processing this information and kind of thinking about how it applies to them. And I understand that too. So If there's silence, I can deal with it.
So to me, I see this being something that partners really well with our fentanyl requirement and our fentanyl grant, but then maybe Title IV after the fact to go above and beyond. That's what I'm seeing? Does that make sense?
Mm-hmm. Mm-hmm. What is that fentanyl? I've heard one ESE talk about that, ESE one, and they were feeling like that they have to meet that and that's priority. And I get it because it's a funded project, but can you explain that project? Because I've been trying to understand what are the main deliverables of that.
Throw Corey Turner under the bus because that's his grant. but I'm in the room around it and hearing just enough about it to be dangerous. Corey, can you add to that or anybody else?
So the grant that I'm on here at Region 15
Mm-hmm.
comes out of I believe it comes the training stuff that we've gotten comes from UT San Antonio, I believe.
Mm-hmm.
And it sounds like more of a grant for us to disseminate or do trainings to school staff. I don't think it has much to do with the student aspect of it. And
Mm-hmm.
that's my understanding.
Right.
I'm fairly new to this world, so I don't want to mess something up. But I kind of feel like that's where this grant is more of
Right.
the teach or the workshops or stuff for our like nurses or the staff.
Right, right. Yeah, I was wondering about that. And I understand like school districts were telling me that I don't know if it's a heavy lift to do that, but they're saying that they're stretched, trying to meet that grant's need that, and I get it, but at the same time, it's not really targeting students. And so it's just, to me right now, I realized that that was going to be a hurdle that I'm going to have to cover, a jump, I should say, because I'm trying to explain to them, I get it, you have to satisfy that grant, but we've got the resources to support schools and parents and their community outreach. And you don't want to just miss the opportunity for these resources that are now available because you feel like I got to do this 1 hour training. And I'm not trying to minimize it or be critical of it, but how basically I'll tell you, how do we sell tops in that context? Like, I don't want us to feel like we're competing. I want us to feel like we're working that we've got something that can support them or work alongside them. And I think that really, when I heard that from one school district, it really told me how do us, our team, have this conversation, or I don't want to sound like a salesman, but how do we pitch tops, when they feel like I can't do anything else, but we're trying to reach students that really need this and parents as well. So, and that's what I heard too. It was a 1 hour training in fentanyl.
Yes, ma'am. And to me, it seems like this would work great side by side with not. It doesn't have to become a competition type thing. To me, it seems like what y'all are providing is some of the same, but it's also a
Mhm.
difference, and so that can work very good side by side.
Exactly. And I mean, it was just one school district, another school district that says, let's just partner up and we're going to do it. And I'm going to be talking to the superintendents, and just like, what we're doing will help them meet what they need to do for their mental health grant. So it's just a matter of just trying to figure out how to work together to understand what their needs are and what we can support them with. But we run the whole gamut. I mean, from the education for the students, the parents, the community, I mean, the whole spectrum. So I think we touch a lot, that everybody would have something there that would meet most of their needs.
I think your program will dovetail well and be able to have a district not only just meet all the requirements surrounding
Mhm.
fentanyl and opioids, but also to, to to have good outreach to their students and their staff and their community. So
Right.
has that potential. And so, any other
Mm.
questions? Well, I appreciate you greatly for taking the time and taking the effort, for writing your grant, as somebody that's been there, done that, and then trying to figure out how to reach across the whole state of Texas. And so we're glad we were able to provide an opportunity. I may be sending you, we have a very good ESC counselor group as
Oh,
well
good.
that
Okay.
might be interested in this, might have some overlap in this. And so I'll try to reach out to you later today by email and give you another good contact, Jenny Yannick, who is
Okay.
out of Region 12,
Okay.
Waco. It
Okay.
might be a good contact. And so I hate for you that all of you in the field that do both of our meetings, you may get to see this again, but hey, guess that repetition's not a bad thing, especially when you get as old as me.
Right,
So
right. Well, I just wanted to say to everybody, I know that you're hearing this information, and as you hear this information, you might know somebody who at your ESC who like this is what, this is who needs to be connected to connect to us. And I would really strongly encourage you that I really strongly believe that we have that because we're mandated by this, we've got a grant by the state. This is a state grant that somehow we're going to have to reach your area. It's not like we're coming here and just railroading and just coming in, but we are here for you. And whoever is that point of contact that can get the wheels turning, we would like to to meet that person sooner than later. And ideally, I would love to be able to say that by the end of the summer, I've talked to every ESC, the right person who needs to be reached, and that we have that initial conversation and have a path forward, because I want to have a path forward with every ESC. And it will happen, because like I said, and I'm going to wrap this up, is that we are honoring lives lost due to opioids, and we're empowering students in prevention. And I think that that is where we all are here. We know we have this crisis. And so it's a matter of just trying to figure out this and how it can work for you. And we would love to collaborate with you. And speaking on behalf of my leadership team, Dr. Marsha Ori and Dr. Alonso, I'm excited, Rod, that we were able to get this call. It's serendipity, because this meeting came the day after our contract was fully executed. We're ready to roll, and we want to get into conversations with ESCs. So as you go about your day, have a wonderful day, and just thank you so much. And I'm not wrapping up your meeting. I'm sorry, Rod, but I just thank you, everybody, for just listening to my short talk here today.
Dr. Purcell, do you have a preferred contact procedure, or for ESCs to contact you? What are their next steps they need to take?
Okay, right now, because we're building up our infrastructure, like all of our, systems of contact, for right now, just email me.
Okay.
And eventually, I don't even have we're just hiring our staff. I'm a
Right.
one-man show until we're going to be hiring 25 people at least.
Okay.
But contact me. I'm on the ready.
Great.
I could take the emails, and we're going to have people starting to work and soon and help, and we're going to have that technical support built up very quickly. So,
Okay.
but just reach out to me, and if everybody wants to just say, I don't know what, I need to think about it, that's fine. And then say, but give us a call, and
Great.
we'll just start with me, and then we'll go from there.
Great.
Okay.
Thank you.
Okay.
Thank you.
Thanks for joining us for today's episode. You can find more information about Title IV Part A on our website, which is linked in the bio, or on the TEA Title IV Part A Student Support and Academic Enrichment site, also linked in the bio. Be sure to subscribe to our channel to receive updates on new episodes.